Despite the growing incentives to get protected from COVID, the pace of vaccinations in the U.S. is still slowing down. According to the Centers for Disease Control and Prevention, more than 42% of Americans are fully vaccinated so far. Nearly 52% of Americans have received at least one dose of the vaccine. For more, let's bring in Alex Tin. He's a CBS News reporter covering the pandemic. Hi there, Alex. So we are now less than a month away from President Biden's July 4th vaccination goal. How likely is that to be met?
Well, it's interesting because remember when President Biden first set out the goal, we really tried to parse the numbers and figure out, is this a realistic goal? Is this something that he can reach? And one of the issues that we had to kind of separate out is when you would look at the rate of, people getting their first dose. That's people starting vaccination either with the 1-dose Johnson & Johnson vaccine or the 2-dose Moderna or Pfizer vaccines. We knew that at least some of that rate was coming from people who weren't adults, right? Again, his goal is 70% of adults by July 4th. We knew some of those were adolescents, and so we had to kind of separate those out. And after doing that, we saw that already that goal was just shy of what he needed. We knew that the pace of the current, people getting first doses was slower than what they needed to reach that July 4th goal. Now, the pace has continued to fall. It's to the point where you don't even need to separate out the adolescents or the teens. Even if you assumed every single person getting a first dose was an adult, which they're not, then the pace would still be too slow to reach that July 4th goal. Now, obviously, there is time for the pace to pick up. The pace has picked up in the past after different efforts that they've encountered, both from lotteries, everything down to the mask guidance, and all these incentives to get vaccinated. But again, that gap is growing larger and larger. And in fact, we saw a stark reminder of that yesterday when the pace of adults getting the pace of people getting their first dose dropped to 389,000. I mean, that is the lowest it has been since 2020, not the beginning of this year, but since last year. And that's going to be a steep hill to climb over these past few weeks.
Really steep, it sounds like. Well, Alex, you've reported about expiring doses of the Johnson & Johnson vaccine. Why are they not being used, and where will they end up?
Yeah, well, it is a complicated question because we know that some of it has been that increased vaccine hesitancy that has shown up in surveys around people, especially women, who are in that group that have the rare but serious side effects, those blood clotting issues that were looked into with the Johnson & Johnson vaccine earlier this year. So that's definitely part of it. We also know that, let's be honest, there's just a massive amount of supply with the Pfizer and Moderna vaccines, and those have been to the point where there is no lack of supply and people have their choice between all these three vaccines. And many people will go to a clinic that is offering just Pfizer or just Moderna being offered by the health providers in their location, and they will elect to get just that. So some of it is the supply that is really large now. Some of it is the demand that has decreased for the shots. And we know now that there's millions of these shots that have been delivered and not yet used. Now, we expect right now, and this is according to reporting by the great Max Baer, who's one of my colleagues here at CBS, that it's currently just a few thousand, number of those doses that have been delivered but not yet used that are likely to expire if they aren't used this month. But we know that's likely to increase. And you can look 3 months back. Again, 3 months is the current amount of time those doses can last on a pharmacy shelf in a refrigerator before they need to be frozen or something else needs to be done to extend their expiration date. And we know there are millions of doses that could potentially expire if they're not used by next month. And that's really when we're going to run into those issues that both the FDA, Johnson & Johnson, and the White House are really trying to address, trying to minimize wastage of that vaccine.
Yeah, well, some FDA officials are meeting on Thursday to discuss COVID vaccines for kids. Alex, do we know specifically what they're expected to discuss?
Well, the FDA has laid out a very extensive briefing document and agenda for these, independent panel of advisors to discuss tomorrow for the FDA. And the main topic that they're going to be discussing are pediatric vaccines used for COVID-19. And we're not just talking about the ones that have already been approved. We knew how that worked. Many of the evidence that was produced and generated from the companies in order to complete those applications, we already went through that process. What they're really looking at here is for the younger kids. We know that the doses are going to be different. We know that the risks are different for younger kids. And at the end of the day, what the FDA has laid out in their briefing document and their agenda for these, independent panel of advisors that's going to meet tomorrow is to consider the question of, do the benefits still outweigh the risks when you're considering doses for these younger children, especially when you consider not just their lower risk of getting severe COVID, but the potential of more unknowns and the potential of other issues that might come up when you're examining this smaller subset of Americans. And I'm sure we're going to hear a lot about that tomorrow. We're going to hear presentations both from the FDA as well as from an industry trade group that represents both Moderna and Pfizer, both of which are trying to field vaccines for these younger recipients. And that is the debate we're going to hope to hear tomorrow. That's the advice that this independent panel of advisors is going to give to the FDA.
And American pharmaceutical company Merck just announced it will be working with the U.S. government. They'll evaluate whether an experimental oral antiviral drug could help combat mild cases of the coronavirus. Alex, what do we know about this medication?
It's interesting because it really differs from some of the drugs we've seen so far already. You know, obviously there were those monoclonal antibodies that everyone was talking about that could really help reduce the stay of hospitalization. That was the hope, you know, reduce the severity of the disease that people would face when they would end up in the hospital. That was one class of the drugs that everyone was focused on. There was another class of drugs that people were focused on, these other drugs that had been approved for other things. And potentially, if you gave it to patients with COVID-19, you might either reduce the symptoms they're getting, improve their chances of survival, yada, yada, yada. Now, this class of antivirals that was from Merck that has been potentially purchased, it hasn't been approved yet by the FDA, but will be purchased if the FDA authorizes it, could potentially be a game changer when it comes not just to treating people with COVID-19 here in the United States, but also abroad as the United States looks at all these other countries that still have not been vaccinated against COVID-19. And the difference here is that they directly address the actual viral replication in the body. In this case, it potentially creates basically errors when the virus is trying to replicate in your body and prevents it from being able to spread and overwhelm your immune system. And that's really the hope here.
All right, before I let you go, Alex, I want to discuss Dr. Anthony Fauci's leaked emails. On what basis are they being used to criticize him?
Well, you name it. You know, some of it is stuff that we've heard for a long time. And again, I should be clear that there has been a discussion of these emails. A lot of them were just obtained through Freedom of Information Act requests, right? And we saw them from the Washington Post, we saw them from BuzzFeed, but we also saw them from right-wing organizations that have been really critical of Dr. Fauci over a wide spectrum of things. Some of it has to do with so-called gain-of-function research. That's the controversial research that some virologists and has been partially funded by the NIH in order to basically add abilities, add function to those viruses. That has been controversial. It's not entirely clear if that's relevant here, but we know, at least in the case, that some of the criticism that has come around that has come from these emails, come from his discussions about that topic in those emails. And, you know, it really runs a spectrum, not just from that, but even all the way into mask guidance. You know, you will remember that last year there was a real debate over whether people should be wearing masks to mitigate the spread of COVID-19, you know, and we went from that massive public shift where health officials were saying, don't wear masks, you probably don't need it, to everyone needs to wear masks, to, you know, everyone should probably be wearing two well-fitted masks, right? And that shift is something you saw a little bit in the email. So again, there's a lot for critics of Dr. Fauci to pick over in those emails. Is there anything really groundbreaking, anything really, you know, huge? Probably not, but there's plenty to draw from, both for critics of Dr. Fauci, but also for people just looking to get an insight into what the U.S. government's response looked like in those first months of the pandemic.
All right, Alex Tin for us. Alex, I feel like I need to start calling you Dr. Tin. You got every angle covered of this story.
I don't want to go
Thank
to
you so
medical
much,
school,
Alex.
Thank you.